Well, as well as a scan, anybody being investigated for epilepsy will also have something called an EEG. This is an electroencephalogram. It's a very simple test. It involves temporarily gluing some wires onto the head, and then we record the electrical brainwave activity that the brain spontaneously produces. And typically that would be done for a period of time with the person just relaxed and resting. Usually there'd be a period of hyperventilation, so getting the person to breathe in and out very vigorously for a few minutes. And often we use rapidly flashing lights, so-called photic stimulation, to see if that produces any abnormalities on the EEG. And what we're looking for on the EEG is some very typical abnormalities where there are very brief bursts of abnormal electrical activity that typically don't give rise to any symptoms, so the person wouldn't know that they're occurring. They're a very strong indicator that that person's brain is capable of generating seizures. If we see abnormalities on an EEG, that would often serve to very strongly reinforce the diagnosis that may have been made from history already. We wouldn't make the diagnosis on the EEG alone. There are some people who don't have epilepsy, will never have epilepsy, who have similar abnormalities on their EEG. So it's not an absolutely black or white diagnostic test. But if there's a good history, then an EEG is an extremely important confirmation of the type of epilepsy and where in the brain it's coming from. So it's important in that regard. So if we can capture a seizure during an EEG, then that, of course, that would clinch the diagnosis. We'd be absolutely clear about what's going on. We'd often be very clear about what type of epilepsy it is and what part of the brain it arises from. But of course it would be very unusual to catch a seizure. You know, an EEG lasts an hour or so, an EEG routine recording. And people's seizures typically seem to happen fairly randomly. So it's a very hit and miss thing whether you would catch a seizure during a routine EEG. What we sometimes do is record an EEG for long periods of time, hours or days, sometimes with the person staying in hospital in a seizure monitoring unit, sometimes with the person taking a portable EEG machine home with them. And if we record for a long period of time, then we stand a much better chance of catching a seizure. And that can be an extremely important thing, especially if the diagnosis is in doubt or if that person's epilepsy is not responding to treatment. Broadly speaking, treatments for epilepsy have been developed and trialled in two broad categories of epilepsy. On the one hand in focal onset seizures and on the other hand on generalized seizures. And the judgment about whether somebody has focal or generalized seizures is often made on the history because we don't actually catch a seizure during recording. But sometimes the EEG can give us a very clear indication whether this is a focal onset or generalized seizure. That does have some benefit in terms of selecting the treatment that we use.